Hello. Today I thought I would talk a little bit about VCUGs. VCUGs are x-rays that we do for children who are having trouble with peeing, pain with peeing. It's an x-ray for us to see that there's not any reflux happening. And so what I mean by that is there's not any pee that's going back up into the kidneys after a child has peed. That can be super painful, and so it's something that we are able to see through an x-ray with the use of a catheter. So when I'm talking to children about this procedure, the first thing that I do is I talk to the parents. Especially for younger children, for toddlers and preschoolers, I want to make sure that I'm using the correct language that they use at home. Not everybody calls a penis a penis. Some people call it a pee-pee. Some people call it a wee-wee. There's so many different words that families are comfortable using with their children for the anatomy of the body that I just want to make sure that that's not something we have to address, and I'm using a comfortable, normal, familiar language for them. The other thing that I talk to the parents about is that in my preparation with their child, I'm going to be bringing the parents in to respond to a question. And that question is, are you okay with the doctors and nurses looking at Tommy's pee-pee today? And they're gonna say yes. And the importance of that is I feel like it's so important to talk about consent with these children in a developmentally appropriate way. I want them to know that mommy and daddy have said, yes, Tommy's pee-pee is hurting and we need to make sure that it gets better. So I, as mom or dad, say that that is totally okay for somebody other than mom or dad to look at Tommy's pee-pee, because I think that's something that we need to do to help him feel better. So we talk about that in a very developmentally appropriate way, and I answer any questions that they may have about that. And then the next thing that we do is we talk about how are we going to make sure that, we help Tommy's pee-pee or whatever feel better. I'll talk about where they get to go. So we're gonna go to a different room, and that room is going to look like this. So there is a bed with a pillow, and there's a nice big camera right here. And this camera is gonna go right over top of your body, and it's gonna take pictures of your belly, because inside your belly, there's something called your bladder. And your bladder is where all of your pee gets kept. And sometimes our bladder has an ouchie, or our bladder hurts. And so we need to make sure that everything's okay with the bladder, and this camera takes a special picture through our body into our inside of our tummy. Nothing touches you, nothing hurts you. It's just gonna take a picture for the doctors to see what's going on with your bladder. So another thing that we're gonna do is, because the doctor and nurse needs to be able to see how your pee is, we're gonna have to have them touch your, whatever word it is, your pee-pee. So in order to do that, at the hospital, we wanna make sure that we are super, super clean. So your nurse or your doctor are gonna wear gloves. They'll have gloves on, so I'll bring gloves, and they'll have gloves so they can play with those. And then we'll also have this tiny little cotton ball that we're gonna wipe onto your pee-pee. And this is gonna make sure that everything is super, super clean. What we actually do put in the procedure, what we put on here is a very potent, it has the ability to stain things. It's dark red and kind of brownish color, and so I don't really like to use that, just because in case they brought a stuffed animal or something that they're comfortable with, I'll do this motion on their stuffed animal and they can do it too, and that way it's not actually staining it. So we'll use this, we'll do it 3 times, we'll go wipe, 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 and then the next thing that we're gonna do is inside, there is a little hole inside where you pee. And we need to have a little tube go from that little hole all the way to your bladder, that little spot inside of your belly that stores all of your pee. And so how we're gonna do that is we're gonna use this tiny little tube. And so they can touch it, they can play with it, and we'll talk about how this tiny little hole where your pee goes through. When we are scared or we're nervous, we can get really, really tight. It can get really tight and it can squeeze, and that makes it really hard for the little tube to go through. So when we're taking deep breaths and we're relaxing and we're going, or maybe for younger kids, we're blowing bubbles. If they can't understand the concept of blowing out and taking deep breaths, I'll just have them blow bubbles during it. So we'll practice blowing bubbles beforehand too. When we blow bubbles and when we take deep breaths, that helps your little pee hole relax so that this little tube is able to go in there as painlessly as possible. And then once that tube is in place, the nurse will use a little bit of tape, and so I'll have tape, I didn't bring tape, and they'll tape that tube right onto your leg so that it stays in place. And then the next thing that we're gonna do is we are going to, ooh, I forgot to add, when they're laying on the bed, it's important for them to sit with their legs in a frog leg or butterfly position. So what I mean by that, I have Lammy right here, is when they're laying flat, we want their legs to kind of go inward like this and up towards their chest. And in order to do that, we call it frog legs or butterfly legs, just to give them that visual of like up like this. And that also helps that little pee hole to open up as well. So both of those things are really important. Frog or butterfly legs and taking deep breaths or blowing bubbles. Once that tube is in place, the doctor then is going to give it some special water. And so you can call it picture water, you can call it contrast for older kids that understand, but what this special water is going to do is it's going to light up your bladder, that spot inside of your belly that shows us where your pee is kept. It's gonna light that up, and it's going to show us how big your bladder can get. This is a horrible picture, there you go. So that big spot in there, that is the bladder filled up with that contrast. The doctor is able to see that. And then the last thing that I'll prep children for is the very weird part of once they get to that uncomfortable phase where we're filling up their bladder, at some point they need to pee. And so when that happens, it's really important that they know that they're not gonna be able to get up and go to the bathroom. We want them to pee right on the bed. We want them to do that so that the doctor can keep taking pictures with that x-ray above them, because we want to make sure that that bladder, that spot that's really big, we want to make sure that all of that liquid can come right back out. So that special water needs to go in, and then we need to pee it all the way back out. And so that's the way that I kind of explain that. And so for kids who have just learned how to use the potty, this is very weird for them. So it does take some encouragement. It does for older kids also take encouragement of like, I know this is embarrassing. I'm gonna be at the head of the bed. Nobody has to watch you pee on the bed. We'll put towels underneath you, but this is just something we need to do to make sure this is the most important part of the whole procedure, is to make sure that you get all of that pee come right out of you. So it does take encouragement with this procedure. It is an uncomfortable procedure for a lot of kids. It's an awkward procedure for our older kids. So just being able to meet them where they're at, making this as comfortable as possible, makes the biggest difference. So I hope that that was helpful, and I hope you have a great rest of your day.